This conference will now be recorded.
Yes, the screen is visible, right?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Yes. So in the previous class, we saw what is gastrointestinal tract. Okay. So the gastrointestinal tract, it starts from your buccal cavity, that is from your mouth, all the way to your rectum. Okay. So the parts of the GI tract which we studied were esophagus, stomach, intestine, in that small and large intestine. Finally, it ends in the rectum or anus. So we learned these two terminologies, what is ingestion and what is digestion. Ingestion is the process of consuming something and taking it into the body, something that you're taking into your body through your mouth. Next is digestion. Digestion is the mechanical, that is when you chew, you're going to break down the food, right? So that is called as mechanical breaking down. And what the body does to your food is called as chemical breaking down of food into smaller components that can be absorbed is called as digestion. Next, we also learnt about the hormones which is included in the GI tract for our digestive process. So the hormones are gastrin, secretin and cholecystokinin. Next, we saw part by part, that is the stomach and the intestines. So in stomach, digestion of protein takes place in an acidic medium with the help of an enzyme called as pepsin. Both acid and enzyme are secreted in the stomach by specialized cells. Now, what cells are these? They are the parietal cells. So the walls of the stomach are lined with parietal cells that secrete mucus and gastric juice. So what is gastric juice? Gastric juice is nothing but a combination of hydrochloric acid and an enzyme called as pepsin. So the mucus lining of the stomach protects the stomach walls from the action of the stomach acid. Next, we saw the intestines. So in intestines, we have small intestine and large intestine. So small intestine is further divided into three parts, that is duodenum, jejunum and ileum. And we saw what all changes takes place to the food that we eat. So digestion of protein takes place in alkaline medium in the presence of enzymes. Digestion of carbohydrates and lipids also take place in the presence of enzymes and also bile salts. Then absorption of the digested foods, vitamins and minerals take place in the small intestine. So the next question would be, what does the large intestine do? So in the large intestines, there is absorption of water, electrolytes, vitamins, and finally evacuation of feces takes place. So in this GI tract, if there is any dysfunctioning, it may lead to illness or discomfort. So as we saw, what is gastric acid? We all know gastric acid means the first thing that strikes to our mind is hydrochloric acid. So this gastric acid is a digestive fluid which is formed in the stomach, and it is composed not just of hydrochloric acid but also of potassium chloride and sodium chloride. And this HCl is secreted by the parietal cells when stimulated by food, or even sometimes the thought of food also helps in the secretion of HCl. So this HCl, this gastric acid, it maintains the stomach at a pH of 1 to 4. That is, HCl is acid, right? So that's why it maintains the pH at 1 to 4. We saw how gastric acid is produced. Okay, so how is this produced? So gastric acid is secreted from the parietal cells when it is stimulated by the vagus nerve, histamine and gastrin. So carbon dioxide and water react inside the parietal cells under the influence of an enzyme called as carbonic anhydrase to form the ions bicarbonate and hydrogen. So this hydrogen ion is then pumped into the lumen of the stomach by a pump called as hydrogen potassium ATPase pump. Okay, the same way chloride is secreted from the parietal cells into the lumen by a process called as simple diffusion. Then this hydrogen ion and chloride ion combine with water in the lumen to form hydrochloric acid. The bicarbonate ion, which was formed under the influence of carbonic anhydrase, is secreted into the bloodstream. So this is how your gastric acid is produced. Next we saw what are the functions of HCl. So it kills the bacteria in the ingested food and whatever drinks that we are having. Then it softens the fibrous foods. It promotes the formation of pepsin. So as you can see in the figure, pepsinogen is the inactive form. Only in the presence of HCl it is converted to pepsin. This pepsin helps in the digestion of the proteins. That is, it converts the proteins into short peptides. So this HCl helps in the formation of your pepsin. Next, absorption of minerals like magnesium, sodium, iron, etc. also takes place in the presence of HCl. And of course, it acidifies the food and stops the action of salivary amylase enzyme, which is present in your mouth or buccal cavity. So the next thing is, what are the diseases of this gastrointestinal tract? So we saw achlorhydria. Can you all tell me what is achlorhydria? Achlor or hypochlorhydria? Anyone? Yes, Yashwant?
No, ma'am.
See, achlorhydria, okay, or hypo. Hypo means what? What do you mean by hypo and hyper?
Less.
Yes, yes, hypo means less. Hyper means?
High or more.
Yes, high or more. So hypochlorhydria, okay. So the clue for you is chlor, your hydrochloric acid, okay. Chlorhydria, hydria meaning water, okay. So hypochlorhydria meaning, it means to say there is less of hydrochloric acid, hypo. Hyperacidity, what causes your acidity? Acidity is caused by your HCl. So when you call it as hyperacidity, that means to say there is more of HCl which is produced. Okay, so that is what is meant by achlorhydria or hypochlorhydria. Okay, next we saw the next disease is hyperacidity and ulcers. Then diarrhea, which is watery stools. Constipation, when there is not much water which you are drinking, then it can lead to constipation, because what does the large intestine do? It helps in the absorption of your water and electrolytes, right? So if there is not enough water, then there will be no movement of the contents in the large intestine. So that will lead to constipation. Next we saw accumulation of toxic substances and gases. Then inadequate secretion of saliva. Now supposing in your mouth you are not salivating properly, then you can't swallow your food. And if you can't swallow your food, then that is also a disease of your GIT, because as I said, your GIT starts from your buccal cavity. In the buccal cavity only you are secreting your saliva. So if the first step itself there is some problem, then that also is considered as a illness or disease of the GIT. Lastly, we saw ingestion of poisonous substances accidentally or intentionally. Okay, so for all of these diseases of GIT, we have a cure or a solution. Okay, so we will look into each of these in detail. First, we will look into what are the diseases, how it is caused, and then we will look into what are the treatments. So What is gastrointestinal agents? First of all, any inorganic substances which can be used in gastrointestinal disorder are called as gastrointestinal agents. Okay, so any inorganic substances which can be used in the gastrointestinal disorder are called as gastrointestinal agents. So now this gastrointestinal agents is further classified. Okay, so you can see that there are basically four main classifications. One is products for altering the gastric pH. Next is protectives for intestinal inflammation. Next is adsorbents for intestinal toxins. And last is cathartics or laxatives, which is basically for constipation. Okay, so in the first classification, that is products for altering gastric pH. Now, what is the pH of this one, gastric juice? Can you recall and tell me? What is the pH? Yes, Meghna.
From 1 to 4.
Yes, 1 to 4. Now, what do you mean by altering the gastric pH? Altering means either you're going to decrease it or either you're going to increase the pH. So based on what you want to do, it is further classified as acidifying agents and antacids. Okay. So what do we mean by acidifying agents? That means to say it will induce the acid secretion. Okay, antacid means it will try to bring down, it will try to increase the pH and bring down the production of your HCl. Okay, so have you all heard of antacids? Can you give me an example of an antacid?
Eno,
Eno. Okay, any other example that you can give?
Gelucid.
Yes, Gelusil, right? Eno, Gelusil, Digen, these are all the common things that we see, right? Which are elder people or maybe even we also would have used at some point of time. Okay, so those are called as antacids. Now, can you tell me why do you take this Eno, Gelusil or Digen? What happens in your body that you want to take this?
Acidity, ma'am.
Acidity. So what are the symptoms? What do you feel?
Stomach pain.
Okay, then
Throat burning.
throat burning. Actually, it's not called as throat burning. No, there's some other terminology which is used. What is that? The word is very misleading. Which is that word? Okay, the word is heartburn, they say, right? Can your heart burn? No. Okay, just because you feel the pain somewhere in the esophagus, which is very close to where your heart is, they call it as heartburn. Okay, they say I'm having a heartburn. It doesn't mean that there's something wrong with your heart. It just means that you have hyperacidity, and you're feeling that burning sensation in your esophagus, which is a part of your GI tract. Okay, so that is heartburn. So for these symptoms, that is, why do these symptoms occur? These symptoms occur when especially you have any spicy food or when you have any fatty food, that is something which is rich in fats or oil. So when you have these kind of foods, it leads to this one, heartburn or burning sensation, which means to say there is excess of HCl acid which is produced. Apart from this, sometimes the body by itself, due to some disorder, will be producing more of HCl. So to counterbalance this, okay, and to bring it to a neutralizing pH, you are going to take your antacids. Okay, so basically for altering the gastric pH, either you're going to use acidifying agents, that is to bring the pH somewhere between 1 to 3, or you're going to use antacids wherein you're going to increase the pH beyond 3. Okay, so where do we use this acidifying agents then? We saw antacids by using if there is excess secretion of HCl. So when are we going to use this acidifying agents? Yes, anyone? See, we're using antacids when we are when the body is secreting excess of HCl. So when are we going to use acidifying agents? You're going to use acidifying agents in the first disease that we saw, achlorhydria or hypochlorhydria. Hypo meaning less of HCl. So you want more of HCl for the digestion to occur. So during this time, you're going to use acidifying agents. Nothing but agents which induce the acid secretion. So the examples for this is histamine phosphate. For antacids, the example is aluminium hydroxide, sodium bicarbonate, etc. There are many. So the next classification is protectives for intestinal inflammation. So when there is inflammation in your gastric mucosa, you're going to use agents called as protectives. Basically, it gives protection. The third one is adsorbents for intestinal toxins. Now, supposing you have spilled water on the floor, what are you going to do? What is the first thing that strikes to your mind? You have spilled milk, or you have spilled water, or you have spilled oil while cooking. What is the first thing that comes to your mind? You have to clean it up, right? So how do you clean it up? What do you use to clean?
A cloth or a mop.
Yes, you use a cloth or a mop. What does the cloth do there?
It absorbs the liquid.
It absorbs. Now, when I gave you an example of oil, okay, supposing you have spilled oil. Have you seen what your mother or anyone else does when the oil is spilled? What do you do? Usually you will sprinkle flour onto it, okay, maida or any other, okay, wheat. You are going to sprinkle the flour on it. So what happens? It helps in it absorbs the oil, okay. So that is what you mean by absorption. Now, can you tell me what is the difference between absorption and adsorption? Can anyone tell me? Even in layman terms, it's okay, whatever you have understood. What is the difference between absorption and adsorption? Anyone? Very simple. I've already given you one example. You just need to tell me what is that, whether it is absorption or adsorption. I gave you both the examples. You just need to tell me which is absorption and which is adsorption. Yes, Dinesh? Come on, any one of you. Are you all able to listen?
Yes, ma'am.
Then one of you
Ma'am.
tell me, yes, what is absorption? What is adsorption?
Ma'am, absorption means that liquid it will absorbs properly.
Okay, then what is adsorption?
Adsorption means
Okay, so let me tell you here itself. Now, absorption means when I gave you example of milk and water which is spilled, Aisha told me she uses a cloth to clean it. So what does the cloth do? The cloth will absorb, okay? Something it will take in and it will hold, right? And when you squeeze it, again you will release whatever it is holding, okay? So that is absorption. Now, supposing let's take sugar, okay? When you take sugar and you put it into water, what happens? It forms a solution. Your water molecule is taking it into it, okay? That is absorption. Adsorption means it will just hold on to it, okay? And you can't remove it until and unless you do further treatment. So when I gave you an example of oil and I told that you're going to put flour on it, what it's going to do is it is just going to stick or hold on to it so that you can clean it better. That is adsorption, okay? So adsorption means holding on to. Absorption means it will form one phase, okay? It will form like a solution. That is what is the difference between absorption and adsorption. So supposing you have taken some toxins, which is when you have consumed your food or when you have drank something, supposing there was toxins, that is anything which is poisonous, you want to remove those things. Now it would have already formed into a solution or something. You want to remove it. So the easy way to remove it is to take something which will cling on to it, and so that you can retrieve it out. So that is called as adsorbents. So the example for this is your activated charcoal. The last classification is cathartics or laxatives for constipation. Now laxatives, constipation first of all means there was not enough water in your body, because of which there was no movement of the contents in your large intestine, which leads to difficulty in passing your feces. That is your constipation. So to relax, you are going to use agents which are called as laxatives. Examples is magnesium sulfate. Okay, so we will look into each of these in detail. So the first is achlorhydria. So as I said, absence of hydrochloric acid in the stomach is called as, or absence of hydrochloric acid in gastric secretions is called as achlorhydria. A means absent, okay? Hypo means less, hyper means more, okay? So A means absent. So patients with this condition fall into one of the following two groups. That is, patients remain free of gastric HCl after stimulation with histamine phosphate. Okay, that means to say even after stimulating with histamine phosphate, they are free of gastric HCl. That means to say still HCl is not being produced. You are stimulating your body, you're giving it histamine phosphate and saying, come on, produce hydrochloric acid. But still the body is not producing hydrochloric acid. So these patients fall into this category. So now what is the reasons? Okay, so for anything to happen, there is a cause or a reason. So what is the cause here? Cause is subtotal gastrectomy. Okay, so when part of your stomach only is removed, how can your body produce HCl? Okay, so that is what is called as gastrectomy. Part of your stomach is removed, subtotal gastrectomy. Next is atrophic gastritis. So now what is atrophic gastritis? That is chronic gastritis with atrophy of the mucous membrane and glands. So your mucous membrane and glands are damaged, because of which they are not able to produce your HCl. Okay, so that is the second cause. So next is carcinoma of the stomach. Do you all know what is carcinoma? Anyone? Do you know what is carcinoma? The answer is there in the word itself.
Ma'am, it is a type of cancer.
It is cancer, not type of cancer. Carcinoma means cancer. Okay, that is the terminology, that is the proper word, carcinoma. Okay, so that is cancer of the stomach. So when these are the causes for absence of hydrochloric acid. So the next thing is, okay, fine, it is absent. Now, when you're consuming food, you do require hydrochloric acid for your digestive process. So what is the treatment? Diluted HCl you're going to use. So that is what is your treatment. That is, you're going to consume dilute HCl. So that was the first category wherein you stimulated and there was no production of HCl. So what is the second? Patients in whom there is normal lack of gastric HCl but will secrete it upon stimulation by histamine. Okay, so when you're going to give histamine phosphate, the body takes the cue and then it forms the HCl. Okay, so basically two types of patients, one wherein you stimulate and there is no production of HCl, one wherein you stimulate and there is production of HCl. Now in this category B patients, what happens? What are the causes? Chronic nephritis, that is inflammation of the kidneys. Chronic alcoholism, that is, they are alcoholics by nature, they just keep consuming more of alcohol, and we already saw that alcohol interferes in the production of HCl in the previous class. Next is tuberculosis, okay, that is TB, and having hyperthyroidism. These are the causes for not producing the gastric HCl in normal amounts. So what is the treatment? As we saw, when it is stimulated by histamine, there is production of HCl, right? So the treatment for this is administration of histamine phosphate. Okay, so we saw what is achlorhydria. We saw how patients fall into any of the two groups, that is when they are stimulated with HCl and still no production of gastric HCl, we give them diluted HCl because body ultimately requires HCl for digestion. Next category is where we saw patients where there is no HCl, but when they are stimulated by histamine, there is secretion of HCl. So of course, the treatment for this will be administration of histamine phosphate. So patients who fall into category 1, treatment was diluted HCl. So the drugs or agents which are used to increase metabolic acidosis and gastric hydrochloric acid are known as acidifying agents or acidifiers. Okay, so acidifiers or acidifying, there's a mistake. Okay, it's not reagents, it is agents. Okay, by mistake RE has come there. Okay, so acidifying agents or acidifiers are nothing but drugs or agents which are used to increase the metabolic acidosis and gastric hydrochloric acid. Of course, the example for this which we saw was dilute hydrochloric acid. Now, why is it mentioned dilute hydrochloric acid? Can we give concentrated hydrochloric acid to patients, who are not able to produce or who are not able to maintain HCl in their stomach? Can we give them concentrated hydrochloric acid?
No, ma'am.
Why? Why can't we give them concentrated hydrochloric acid? It will solve the problem, no?
Yes, ma'am.
So why can't we give them?
It is more powerful.
Yes, it is not powerful. You can say it is highly acidic in nature, no? So if anyone even tries to consume a few drops also, it is going to burn your GI tract. Okay, first of all, it will burn your buccal cavity. Then if you have taken more amount by mistake, it's going to burn your esophagus, ultimately your stomach, intestines, and the person will die. Okay, so that is the reason you don't give concentrated HCl, but you give a diluted form of the HCl. So in this acidifiers also, there are 4 types. So the first one is gastric acidifiers. So what is gastric acidifiers? These are drugs which are used to restore temporarily the acidity of stomach in patients suffering from achlorhydria or hypochlorhydria. Okay, temporarily you're going to restore the acidity of stomach, therefore it is called as gastric acidifiers. The second type is urinary acidifiers. Now these are the drugs which are used to render acidic urine to enable treatment of some type of urinary tract disorders. Okay, so your bladder and your urine also has a certain pH. Okay, so when that pH is not maintained, then that also leads to problems. So drugs which are used to see through that your urine is acidic, they are called as urinary acidifiers. Okay, next is systemic acidifiers. So systemic means it is something related to your blood circulation, right? It is also called as systemic circulation or blood circulation. So the drugs which are able to neutralize the alkaline body fluids, that is particularly blood, in patients who are suffering from systemic alkalosis, are called as systemic acidifiers. Okay, so by this time you should know acid means the pH is less, alkaline means the pH is more. So supposing in a patient the pH is more in their blood, you're going to use agents which will neutralize the pH, that is bring it to a range of 7. So when you use drugs for this, they are called as systemic acidifiers. Okay, last one is acids. So acids are used as pharmaceutical aids in the preparation, laboratory quality control, etc. Okay, so these are the 4 types of acidifiers. So we will look into dilute hydrochloric acid. So what is the chemical formula? The chemical formula is HCl. In the bracket you can see it is written 10% weight by weight. That is diluted hydrochloric acid you're going to use in a percentage of or as a 10% solution. Okay, the molecular weight of hydrochloric acid is 36.5 because hydrogen ion gives 1 and your chlorine gives 35.5. When you add it up, you get 36.5. That is the molecular weight. IP limit. What do you mean by IP limit here? Can you tell me what is IP here?
Indian Pharmacopoeia.
Yes, correct. IP means Indian Pharmacopoeia. So the limit what is told in the Indian Pharmacopoeia is it contains not less than 9.5% and not more than 10.5% weight by weight of HCl. See, your aim is to produce 10% hydrochloric acid solution. 10% hydrochloric acid is also called as dilute hydrochloric acid. So when you're supposed to prepare 10% solution, there may be a few errors, but the errors or the limit is such that it should not be more than 10.5. Okay, it should not be less than 9.5. It should be somewhere within the range of 9.5 to 10.5. So that is the limit which the Indian Pharmacopoeia has prescribed for the preparation of your dilute hydrochloric acid. Not less than 9.5 and not more than 10.5. If it is less than 9.5, then it will not show the desired result for which you are taking. If it is more, then it will cause your more other symptoms and other disorders. So therefore, it should be within this limit 9.5 to 10.5, and this limit is given in your Indian Pharmacopoeia. Next is category. Category means nothing but uses. What are you going to use this for? Okay, so this dilute hydrochloric acid, we saw that it is used as a gastric acidifier. So that is its use. It is also used as a pharmaceutical aid. That is, aid means in the preparation or in the help of something. Okay. Next, we will see what is the properties of dilute hydrochloric acid. Properties meaning physical and chemical. So physically, it is a colorless liquid and it is strongly acidic in nature. Then it is miscible with water. What do you mean by miscible?
Ma'am, floating.
No? Anyone else? What do you mean by
Greasy?
miscible? I'm
Greasy
sorry.
kind.
No? Anyone else? There are two terms, miscible, immiscible. No idea?
No, ma'am.
Okay. See, miscible means something which will mix. Okay. Immiscible means something which will not mix. Okay. That is what is the difference. Okay. Miscible means something which will mix. Immiscible means something which will not mix. So when you take dilute hydrochloric acid, it is miscible with water. See, when you add acid to water, you will see one state, right? You will see that there is a clear solution, right? You will see it is a colorless liquid. What it means to say is they both have combined or mixed well. Supposing if you take oil and water, do they mix? If you take oil and water into a test tube and you keep shaking, you heat, you do anything, will it mix oil and water?
No,
No,
ma'am.
ma'am.
Yes, it
No,
will
ma'am.
form. Yes, it will form two separate layers. You can see that it is not mixing, and you can say that yes, the bottom one is oil, the upper one is water. That means to say they are immiscible. No matter what you do, they will not mix and they will not form one phase. That is called as immiscible. Okay. So dilute hydrochloric acid is miscible with water and alcohol, and it has a specific gravity of 1.18. So that is its physical property. Next, it is a strong acid and attacks metals, forming their hydrochlorides with the evolution of hydrogen gas. Now this is its chemical property. Okay, as it is a strong acid and it attacks metals, when it attacks metals, it forms their hydrochlorides with the evolution of hydrogen gas. Even in highly diluted form, it is very strongly acidic to litmus. What do you mean by litmus here? Do you know what is litmus? You must have heard it, no? In your chemistry experiments.
Yes, ma'am. Yes, ma'am.
Where have you heard this? Litmus. In your litmus paper, right?
Chemistry, ma'am. Yes, ma'am.
Yes, I already told chemistry. Again, he's saying chemistry. Okay, so litmus paper means you have two types, right? You have blue litmus and red litmus. Okay, so when you take a blue litmus paper, and even this diluted hydrochloric acid also, if you treat, it is going to turn your blue litmus into red litmus. It will change the color blue to red. That is, even if you are using a 10% solution, it is still acidic in nature. So these are the properties of your dilute hydrochloric acid. Next is, what are the ingredients? Ingredients meaning what all are you going to use to prepare your dilute HCl. Of course, you're going to use HCl, hydrochloric acid, and since you're preparing diluted form, dilute means you're going to use a solvent. The solvent which we're using here is purified water. How are you going to prepare? So preparation, it is prepared by mixing 274 grams of hydrochloric acid and 726 grams of purified water. Okay. Now you might be thinking, ma'am, HCl and water, both are liquid in nature. What are you saying grams, grams? So how are we going to measure this then? I'm saying HCl is 274 grams and we have to take water 726 grams. So now how are we going to use this and prepare HCl when I know that both are liquid in nature? How will we prepare this then now? When you come to college, I will tell you prepare dilute HCl 10%. I will give you this procedure and say mix 274 grams of HCl and 726 grams of purified water and prepare HCl and give it to me. How will you prepare? I've given it to you in grams. You will go near the place where chemicals are kept, and you will take the chemical and you will think, oh God, this is liquid. Ma'am has told to measure in terms of grams. I know that this has to be measured in ml. Now what do I do? So what will you do? Anyone? Basic chemistry, which you have studied. You people are so quiet, you will not even unmute yourself and tell the answer. Even if you don't know, you will not unmute and say, ma'am, I don't know the answer. You will all be blank, and I am sitting here. This is very challenging, to take the class online when there is no response from the other side. Okay, fine, I'll give you a clue. What is density? Basic, you should know. What is density?
Mass per unit volume.
Volume, ma'am.
Mass by volume. Density is mass by volume, right? So do you know what is the density of water? Density of water is close to 1. Okay, so when you know density and when you know the mass, all that you have to do is you have to calculate volume. So D is equal to M by V, right? Now since you need to calculate volume, that is V, you're going to do it as M by D. Now I've given you the mass 274 grams, and now since you know the density also, you will calculate how much volume you're supposed to take. Based on that, you will then convert it into ml, and that one you're going to measure and prepare. Okay, it is as simple as that. So your basics, you have to be very strong. Okay, if you know the density of a liquid, you can convert from grams to ml. So that is how you can prepare. Next is test for identification. Now, how are you going to identify that what you have prepared is actually your dilute HCl? So you have to do some tests. That is called as test for identification. Aisha, once Yashwant rejoins, please take a screenshot of the attendance.
Yes, ma'am.
So how are you going to identify? So when you add KMNO4, when added to KMNO4 with dilute nitric acid, chlorine gases evolved. So when this chlorine gas is evolved, it is a confirmation that yes, HCl is present. Okay. Next, to acidified solution, add silver nitrate solution, shake and allow to stand. Curdy white precipitate is formed, which is insoluble in nitric acid but soluble after being washed with water in ammonium hydroxide, from which it is reprecipitated by the addition of nitric acid. So these are the two tests that you do to identify whether the solution that I have given you is dilute hydrochloric acid or just water. Okay, so if it is just plain water, when you add KMNO4 with dilute nitric acid, chlorine gas will not be evolved. By this you can say, oh no, ma'am has not given me 10% dilute HCl. She has just given me plain water, because of which chlorine gas is not getting evolved. So this is not dilute HCl. But if dilute HCl is there, you will see that chlorine gas is evolved. So confirming whether it is there or not is called as identification. Okay, so the same way, these are the two tests for identification. Next is test for purity. Next, you want to check whether the solution that you have prepared is pure in nature or not. Okay, so this has to be tested for arsenic, heavy metals, sulfate, sulfite, free of chlorine, bromide, and iodide and residue on ignition. So these are the tests for purity that you will perform on your dilute HCl. Next is assay. Assay means also it is checking how much of dilute HCl is actually present. See, the IP told you a limit, right? 9.5 to 10.5. So you're going to check whether it is there within the limits or not. So how you're going to do this? You're going to weigh accurately 6 grams of HCl add 30 ml of distilled water, mix and titrate with 1 normal NaOH solution using methyl red as indicator. Okay, so each ml of 1 normal NaOH is equivalent to 0.03646 gram of HCl. Okay, so once you do this and you get a reading, you're going to put it into a formula, and then you're going to find out the percentage purity. You're going to find out how much of percentage of HCl is present. If it falls within the limits, then it is fine. If it falls, less or more than the limits which is prescribed in the IP, then you have to discard that batch and you have to prepare a whole new batch and again check for its identification, purity and assay. Okay, so assay means finding out the percentage of the compound. Next is storage. It should be stored in well-closed container of glass or other material at a temperature not exceeding 30 degrees centigrade. Okay, so this is how the prepared dilute HCl must be stored. Next is, what is the dose? The dose is about 0.6 to 8 ml. That is, it depends on the severity of the disorder. Now, supposing your body is not at all producing, the maximum dose you can give is 8 ml. Supposing your body is producing HCl, it is just not within the limits of the gastric HCl produced, then you're going to give a lesser dose, say 1 or 2 ml. So this dose is calculated based on how much HCl is not produced in your body. Now this acid, you're not supposed to directly take it. See, even though it is dilute hydrochloric acid, it is still acidic in nature, right? It still turned the litmus paper blue to red. So this acid should be diluted with 25 to 50 volumes with water or juice, and it should not be just drank as such. It should be sipped through a glass tube to prevent reaction on the dental enamel. Dental enamel means the part which you can see on your teeth, right? The white part, that is called as the enamel. So you're supposed to sip it through a glass tube to prevent reaction upon dental enamel. Why glass tube? Why can't you use a straw here? We all drink juice through straws, right? So why can't we drink it through a straw here? Yes, Pooja? Why can't we drink this through a straw? Very bad. Poor response. You can't drink it through a straw because it is acid, right? Acid will burn the straw, right? That is why you're going to sip it through a glass tube to prevent reaction. Okay, you're going to prevent the reaction with the straw, and since you're going to sip it and not gulp it just like any other normal juice, you are thereby preventing the HCl to damage your dental enamel. Okay, and when should it be taken? It is taken during or after meals, given in conjunction with iron therapy in hyperchromic anemia. Okay, so it will be taken during your meals or it will be taken after your meal so that it helps in the digestion process, and sometimes it will be given in conjunction. That is, it means to say simultaneously with iron therapy in hyperchromic anemia. So this is the dose. Next is the use. Use we already saw under category, right? So it is mainly used as a pharmaceutical aid or as an acidifying agent. Then it is used as a gastric acidifier when levels of HCl in gastric juice are low. And it is externally used as a solvent, catalyst in basic pharmaceutical and as acidifier. Okay, so with this we finish acidifiers. Okay, we finish acidifiers and we finish one of the compound that is given in your syllabus, that is your dilute hydrochloric acid. Any doubts, anything that you didn't understand?
No, ma'am, nothing. And we understood.
Okay, so if you do have any doubts, you can clarify it in the next class. So in the next class, we'll start with hyperchlorhydria and we will start with antacids. Okay, Aisha, please send me the attendance.
Yes, ma'am. I'll forward it in the group.
Okay. Okay, thank you so much. I'll see you in the next class.
Thank you, ma'am.
Thank you, ma'am.